Hi, thanks so much for joining us for this edition of National Council Conversations. Today, we're going to be talking about a new paper that's been released called The Roadmap to the Ideal Crisis System. And this paper, the National Council was so lucky to be able to support the great work that was done by the two organizations, the Committee on Psychiatry and the Group for the Advancement of Psychiatry. And they were able to collaborate with the National Council's Medical Director Institute. Joining us today for this conversation is Dr. Joe Parks, who is the medical director for the National Council and helps to run the Medical Director Institute for us. And we're so lucky also to have Dr. Margie Balfour, who is the Chief of Quality and Clinical Innovations for Connections Health Solutions. But most important about Margie is she is a national expert on crisis systems and was one of the lead authors for this paper. So let's start with a very basic question for the two of you. There are a lot of things that have been written about improving the crisis system. What makes this paper different than other things that we've seen before?
Well, thanks for having me. And yeah, there's a lot of interest in crisis right now and a lot of stuff coming out around crisis. And so far, most of it focuses on what the services are and what the mobile teams should do and what the call centers should do and what kinds of facilities there are. But what was kind of missing is how to build it and how it should function as a system and some of the underlying kind of structure and process that you need around governance and finance and then being able to kind of evaluate where a community is in building a system. And so that's what we really set out to do was build off of all the great work that's been done on the what and then start to focus on the how.
Yeah, so it's almost like taking this from like being a grant kind of program or kind of a standalone thing and trying to put some structure. Would that be a good way to describe it, Joe?
Absolutely. If you think about it by analogy, if 911 just consisted of a phone number, some ambulances and ERs, and there was nothing else around it, no ambulance district, no way of funding it, no way of coordinating who's in the ER with who goes to the clinics, it would back up and stop working in a minute. And this paper talks about what are those surrounding structures for financing and for coordination so people can, once they're not in a crisis, move on and stay out of a crisis and have their life be different as opposed to dropping back in a crisis.
So let me ask the two of you, what do you think are some of the most interesting things that this paper highlights that haven't been talked about so far previously?
I think one of the key things is accountability. So the services are super important because those are the core of what is going to be providing care for people. But you need them all to function as a coordinated system so that every service is working together to get the person the care they need, to keep them stable in the community as much as possible. And if you've got multiple moving parts like that, you need it's like an orchestra, you need a conductor. And so what the paper talks about is how governance can be structured, how that can be tied to finance, how that can make sure that there's stakeholder input so that all the different pieces are held accountable.
And then, in addition to accountability, Chuck, it also goes into what is a good quality service once you're in the mobile crisis or once you're in the crisis receiving center. What are the treatment guidelines? What are the screening practices? What are the data that's tracked so you can manage the system and make sure the quality is good? So it's governance, it's the whole range of services, and then it's what are those good clinical practices that are inside those services.
Yeah, I was just sitting here thinking about the title of the paper. It's called A Roadmap. So it's basically like, how do I get, for those of us who remember things like the triptych or something, right? How do I get from A to B? And as you mentioned, Joe, it not just kind of doesn't just to talk about it at the big level, but also how do we know if we're doing a good job? I like the fact that you guys included, indicators that could be tracked. And so what I like about it is that it really helps people at all different levels, whether they're policymaker, individual clinician, et cetera, or people who run an agency, to really kind of have a sense of things moving. So Margie, I'm just curious, you've been doing this work a long time. How much of your experience did you bring to this paper, and how did you help translate that?
Well, I've been really fortunate to have spent the last 7 years working in Arizona, where, I mean, for various reasons, Arizona over the last 20 years has built, or 20 or more years, has built a really robust crisis system. And so as all this national interest is in crisis, there's a lot of focus on Arizona. And so yes, I brought, quite a bit of that experience. You may have heard of the Crisis Now model, and this kind of builds on that, which is kind of a description of a lot of what's in the Arizona model. So I've been fortunate enough also, we've got a crisis center in Tucson and one in Phoenix, and there's a lot of the crisis system that functions in common between the two, but also that's different between the two. And so that kind of experience sort of helps identify what are the core features, and then how do you tailor things to a community.
Yeah. And Joe, I know you have a huge background kind of running systems. What do you think kind of are some of the things based from your experience, both being a medical director as well as a Medicaid director, some of the things in this paper that you would think would be helpful for people who think at the systems level?
Well, if you don't have a whole system of care, then you have people going back again and again to the one thing you do have. And you'll get overuse of mobile crisis and overuse of crisis receiving if you don't have these other preventive components, and if you don't have connection to a full range of substance use disorder treatment and mental illness treatment for people once they're exiting crisis. And if you don't have, as you said, Chuck, the metrics to measure what people are getting, what they're not getting, and if it's getting better or getting worse. And we mentioned Margie's real life experience. This report also has the real life experience of multiple places around the nation. Many of the subtopic areas give little examples of how a community has done this one particular part well as a concrete way to go forward.
So people who are listening to this interview, what would you want them to do kind of coming out of this? What are some advice? Because I think lots of folks have 988 on their minds. And so what are some of the things that you'd encourage people to do as a result of listening to this incredible conversation?
I mean, this is such an exciting time for crisis. You have momentum coming from multiple directions. Like you mentioned 988, and states are starting to realize, oh, we need to get this implemented, and then you need something to connect to. And then you've got social justice movements trying to get the police out of the business of being the default first responders. And the police, need alternatives and places to bring people. And so I would say find where what's going on in your community, where the momentum is, and try to circulate the report, try to use it as a guide to say, okay, what is it that we do well that we can build on? And here, if we're going to start to be writing policy, and I mean, right now it's a very critical time where legislatures are starting to appropriate funds and write legislation, to say, here's something that is a tool that you can use to make it easier to start to build the crisis infrastructure that we need to build.
Great.
So the tool itself will really tell you what to do. If you just read the executive summary, at the end of it, it lists 10 steps for either communities or advocates. It tells you point by point. And step number 3 or 4 is to use the system report card. In the back, there's a checklist, system report card, where you can go through and rate your system on a 1 to 5 scale for each component you have or don't have. And then you can sit down as a group and make your priorities.
Well, that's a great suggestion, Joe. I love starting with the executive summary, and I love the fact that you guys included checklists. So maybe folks also want to make sure that they share this, I don't know, with their state mental health authority, their Medicaid authority, other people in their community who are really focused on crisis, and maybe use it as a way to organize conversations. So,
because it is a long document. I need to warn the listeners, but we built it so you can take it in easy bites. Executive summary, 10 steps, checklist, and then you can sit down with your accountable group locally, whoever you all decide you want to hold accountable with each other, and get to work.
Great. Well, Margie and Joe, thank you so much both for spending some time with us today talking about this paper, but more importantly, for the work that your committees did in putting this together. I understand it was a labor of love. Maybe it took a couple of years, but I think that also reflects that all the wisdom and experience and insight from around the country that you were able to weave together. So thank you so much. We hope that the folks listening will start taking a look at the executive summary and start having conversations in their communities about how we can improve America's crisis system, one community at a time. Thank you guys so much.
Thank you.
Thanks, Chuck.